slaves were emancipated, they were left without any resources, often to die. So they started forming their own health systems, okay? Started educating themselves, started making their own medical schools, started taking care of their own communities. But still, the resources were limited. It set this segregated healthcare system up where even if a hospital would allow people of color to come in, they were often in the basement or in wards that were not as sanitary, didn't have staffing. So the disparity set itself up from the beginning, just based on racism and bias. And so even today, those things still affect our system.
We find that maternal health among Black women is greatly impacted, and they have poor health outcomes regardless of their education and socioeconomic standing. There have been some very compelling studies that have compared the pregnancy and birth outcomes of Black women who are American as opposed to Black women who have immigrated from West Africa. Black women from West Africa have healthier pregnancies and give birth to fatter, healthier babies than Black women who grew up in the United States. But when the baby of the West African woman grows up in the United States, her baby will then have the poor health outcomes and the high infant mortality of other Black American babies. And when the studies have been done over time, they have found that racism and the experiences of racism and the toxic stress that racism causes in the bodies of Black Americans is what has been found to be the overwhelming link.
So over the last 25 years, we've seen a steady increase in maternal mortality. The U.S. actually has the highest maternal mortality rate of any developed nation. When we drill down to the African American community, we see that an African American woman is 2 to 3 times more likely to experience maternal mortality in comparison to her white and Hispanic counterparts. The knee-jerk reaction is to think this is secondary to access, low socioeconomic status, increased morbidity like hypertension, diabetes. But one thing that's really interesting is when you isolate all of those factors and you look at affluent African American women, women who have had access to health care, who've gone to all their appointments, they are still 2 to 3 times more likely to experience maternal mortality.
There's implicit biases that affect our system, where there are people who, even if you take your child to the physician, you feel like you're not listened to or they don't hear your concerns. I have patients who come here all the time with private insurance and say, no one has ever listened to me. No one has ever heard my situation. I refer them for care, and whatever the situation was is true. It was an issue. And so if I didn't intervene, what would have happened to this child?
We really promote going to prenatal care as early as possible. But the way that the system is built, it really doesn't make that possible for many patients. 50% of pregnancies are unplanned. Mothers, most of the times when they have Medicaid, do not have any health care prior to pregnancy. So when a mom figures out that she's pregnant, she then has to apply for Medicaid. It takes 30 to 45 days to receive your card in the mail or to have an active status. Then once you have active status, you have to find a provider who will take you in your late gestation with Medicaid. You know, patients sometimes, they don't expect to be treated with dignity. They don't expect to come into a clean facility. So I love to see when patients are surprised. And I love to hear patients say, thank you. Nobody else would see me. I had a patient that told me that at the end of appointment. She had called so many other places and nobody would see her because she had Medicaid.
For African American and Black children, we have seen that in certain communities there is a higher prevalence of adverse childhood experiences. Experiences such as bullying, being in foster care, racism, being separated from parents due to immigration and deportation, abuse, neglect, and household dysfunction, and witnessing or experiencing community violence. So the effect of childhood adverse experiences and trauma can have a long-term, lifelong outcome. In fact, experiencing 4 adverse childhood experiences can actually decrease a person's life expectancy by 10 years.
Medical care is comprised of so much more than the interaction that occurs in the office. So we really want to connect providers to people in the community who will help them care for their patients. So there is a ton of work going on in Houston. Many groups are so excited, and it's really been rewarding and encouraging to see.
And so when all providers are engaged on caring for children and break those walls down of bias and making people feel out, then I think we can move.
It takes one person, one step, one project, one moment every single day to slowly chisel away this system. The system did not develop overnight. It's taking centuries to build to where it is, and it's going to take a long time to dismantle it. But each of us play a role. Each of us can do something to dismantle the system. We all have a responsibility.
One of the things that we discovered in our focus groups is that women said, my doctor didn't listen to me. Particularly African American women said that when I presented a problem, I felt that it wasn't taken seriously. So as a woman considering pregnancy, as a woman who's considering a gynecologist, make sure that you have a good relationship with your physician. That should be a relationship you feel comfortable with. If you do not feel comfortable, choose someone else.
You have to take care of your mental health and your general well-being, your stress levels. You have to live in peace. You have to put yourself in a peaceful place, even if around you may be a bunch of noise.
Love yourself. Believe in yourself and take care of yourself. You are a descendant of women who survived the Middle Passage. And through their survival, you are here, and you are here for a reason. Embrace who you are. Do not belittle yourself for anyone. Be strong, be positive, be courageous, and really love yourself.